Why, hello everybody. Welcome back to another Facebook Live. Looking forward to having you back on and talking today about rotator cuff injuries. For those of you who don't know me, my name is Dr. Chris Carr. I'm the clinic director for Pittsburgh Chiropractic and Wellness. Been in practice since 2004, dealing with all things chiropractic, sports rehab, regular rehab, as well as nutrition and weight loss counseling. So today, I got an awesome topic for you. I always like to talk about things that are going on in my life because those give me topics. So I have a good friend of mine. He is currently suffering from a rotator cuff injury. So I thought that would be a great topic because I know a lot of people go through shoulder injuries and they don't know how to recognize them, what to do, who to listen to. So they go into University of Google and they write in rotator cuff injuries when they may or may not be suffering from that. It might be something completely else, something completely different that is just mimicking or masking a shoulder injury. So the rotator cuff itself, so shoulder injuries, they're complicated. Shoulder surgeries are one of the toughest rehab surgeries to bounce back from. It's a lot of rehab. It's very painful. You have to work on getting range of motion back. So that's always the last resort. But a lot of times, if that rotator cuff is torn, there's nothing you can do about it. It's a surgical procedure. There's no rehab that's going to fix it. If they have a complete tear in that rotator cuff, sorry, I wish I had better news for you. So for those of you who do not have a complete tear, for those of you who just have maybe a grade 1 or a grade 2, or those might even have something else like bursitis, tendonitis in the shoulder joint, well, then I got a lot of stuff for you, how you can rehab it naturally without drugs, without surgery. So recommendations first is, how do you recognize if you're going through a rotator cuff injury? Well, first things is that shoulder injuries, typically with the rotator cuff, they happen over time. It's not something that you do one day, then the next day you're really noticing, like, hey, my shoulder's a mess. It's usually an overuse injury. It can come from sports like playing football, softball, any type of racket sports, golf, and it's a repetitive stress. You're doing the same thing over and over and over again. So think about tennis, right? You're usually not using one arm. You're usually using one side, but it's like you're going overhead, backhand, and it's the same motion and the same joint. Same thing goes for playing contact sports. And for those of you who aren't doing that, what else can happen? Well, just think of house projects. So what are things that you're doing over and over again? So maybe some of your stay-at-home mom or stay-at-home dads, maybe you decide to paint your entire house, or maybe you decide to paint a couple rooms. That same motion. Okay, over and over again. Scrubbing floors. Maybe you got really into it and you took care of your whole downstairs. You have hardwood throughout. And you just scrubbed a bunch of floors over and over again. That consistent motion, that overuse, can then lead into inflammation in the joint, and eventually that inflammation causes a problem. So first is recognizing if it is indeed a rotator cuff. So what happens there is you have 3 bones that make up the shoulder joint. You got your top bone of your humerus, you have your scapula, which is in your back, you have your clavicle right across the top. And you have a group of muscles that make up your rotator cuff. Now, what eventually happens, you get this inflammation taking place, you have this, whatever, a fall, a sports injury, an overuse injury, and now it's like, well, how do I know if I have it? It's been bothering me for some time. I don't know if this is what's going on. So testing, how you would know is first, if you see a doc like myself, if you see a PT, if you see your primary care doc, a physical exam a lot of times will put you in the right direction. If it's a severe rotator cuff tear, you can't lift your arm's a mess. You trying to get it above 90 degrees really isn't happening. You have a lot of weakness. So one of the muscle tests that you can do, you would have somebody stand in front of you, you put your arm straight out, and you push straight down to the side, push straight down, and that weakness, that pain, it's usually a hallmark sign that there's a lot of inflammation in that joint. And if you have no strength at all in there, there's usually a rotator cuff injury taking place. So other things, how else would you recognize it? So we have weakness that's taking place. We also have pain at rest. So when you have pain at rest, it kind of sounds crazy, right? Because it's an overuse injury. So you would think that it would be aggravated when you're doing that activity. Well, it is. But also what happens is you have pain when you're not doing anything at all. If you go to bed at night and you try to lay on that shoulder, it's going to hurt. Like, I'm not doing that. I'm going to go on the other side. So that's another sign we have pain at rest. You would also have pain with lifting. So typically lifting up and over your head produces an issue. Usually any type of lifting where it's either to the front or to the side, it's going to produce some grinding or clicking in there. That grinding or clicking in the joint itself is also another hallmark sign that there can be an underlying rotator cuff issue taking place. So outside of a physical exam, how else do we diagnose it? So MRI and CT is the gold standard. So you have an MRI on the shoulder to see exactly if it's torn, if it's just inflammation, if it's bursitis, if it's tendonitis. That's what that testing would do. Usually, you can go through some rehab prior to then, and you can do rehab on your own. You can start off there. And if that's not getting you anywhere, then you can look into further measures by seeking a professional or getting the advanced imaging study done to see exactly what's taking place, because there's really no other way to see what grade tear it is unless you have an imaging study done of the joint itself. So we went through signs and symptoms, how to diagnose it. So let's say now, hypothetically, we've got a tear, or we have a grade 1 or a grade 2 tear in that rotator cuff. Now what can we do? So you have two kind of options, if you will. Some people like to do them both at the same time. Some like to go just straight medical. They'd like to go with a cortisone injection, take anti-inflammatories, and see what happens. Okay. Others like to do things on the natural end. They'd like to go through a routine where they don't want to put the cortisone in their body. They don't want to take the oral pain meds, if you will, because of the addictive quality that these medications have. So they want to go the other route. And then there's a group that kind of want to do both. They want to kind of take the meds, and they also want to do the rehab in conjunction with it. So if you're not going with the steroids and the shots and the meds, which I would recommend you would hold off on as long as possible, and that's your last option, I obviously would recommend you go as safely and alternatively as possible initially. There's always a time and a place for those meds. And the good thing about a shoulder injury is that if it's injured, you can rehab it. So what can you do now? So there's a couple options you can do for treatment. One, so it's rest, right? When you're resting the joint, the motions are going to aggravate it. You want to stay away from, which is tough for some people. So if that painting motion is aggravating it, then you got to hold off on painting. If you continue to do that motion, you're going to continue to aggravate it, produce more inflammation, and then more likely accelerate the injury itself. So you have to rest it anywhere from 4 to 6 weeks. Sorry, but that's how, if you want to heal from this and you're trying to stay out of the surgery table, one of the best things you can do is you can actually just rest it. Next, so think inflammation. It's swelling. It's not so much superficial swelling. It's swelling that's deep into the joint. So how do we get there? Okay. So first you can do icing. Okay, that's the best natural anti-inflammatory. It's 20 minutes on, 40 minutes off, and you would compress it to the shoulder joint itself. So when I say compress it, you put the ice pack directly on the shoulder, and you can ace bandage it around there, or have somebody ace bandage it for you, and that will allow you to compress it so it's going a little deeper. So you can start off with just icing. You do that for a couple weeks on the shoulder joint itself. Next thing you could do is something called contrast therapy. So you would do 20 minutes of heat, okay, moist heat. So you would do moist heat of 20 minutes, and then directly after that's done, you now do 20 minutes of icing. So you do 20 minutes of heat, 20 minutes ice, same thing, compress it. You want to make sure there's a barrier around that. Icing obviously can cause frostbite if you put it directly on the skin. Heat, even though it's moist, you put it directly on the skin, can burn you. So that's the disclaimer. Don't put those things directly on the skin. You want to make sure there's a barrier between the icing or the heating and the skin itself. Stretching now. So now we've gotten some icing and heating done. You do not want to strengthen the joint first. You want to stretch it out. So there's things you can do. So if you were, say, standing at a table, you could bend over, okay? For example, you could bend over, okay? And you would just then it's called a pendulum exercise. You bend over slightly at 45 degrees, and you can spell the alphabet. So you would spell it from A to Z, okay? You can do a crossover arm stretch, okay? Just like so, you grab your elbow, take it across your body, and you hold. Hold for about 5 to 10 seconds. You relax, and then you repeat it all over again. And you can do that exercise. There are exercises you can use, something that's called a TheraBand. These are kind of these big rubber bands that are very hard to break. They're very elastic. They stretch. There are a ton of exercises you can do with this. This will help you. You can take it behind your back, like so, and kind of do a tricep-based exercise. You can tie this around a doorknob, and you can do something called internal or external rotation, which allows you to stretch that joint out. And you can also work on now doing something called front raises and side raises. So you would in turn stand on the band itself, and you then take the motion where your arms coming straight up, and then really slowly lower it down to your waistline. To the side, same thing, standing on the band, take it straight to the side. Once it goes to 90 degrees, pretend like you're holding a can of soup, and you dump the soup out up top. Come back to normal, come straight down real slow. So those two exercises you can do. I give patients those all the time, and that can work on stretching out the joint itself. So those are stretching exercises you can do for that. What else you can do? So once you have it stretched, now you can work on strengthening it. When you do strengthening exercises, a lot of people, they do some things they should not be doing with shoulder exercises. You should not be lifting, okay, over 90 degrees. Okay? As long as you're not trying to become a professional athlete, which I'm fairly confident most of us are not trying to be playing for the Pirates, the Penguins, Steelers, my lovely Gamecocks, chances are we're doing messages where we're going straight up, or we're doing exercise, we're coming straight up and straight down. When you go up above 90 degrees, okay, it makes that shoulder joint unstable. When you continuously do that, you're now putting irritation on that joint. So trying to stay above going up and down, up and over 90 degrees. Hey, Mrs. B. So what else can we do? So we want to eliminate shoulder pressing. We want to eliminate any type of motion where you're going above 90 degrees on the shoulder itself. Now, see, other strengthening exercises you can do. So a lot of it is when we have an injury in the shoulder, we also have a weak back. So you can now work on strengthening your upper back. If you have a rowing machine, okay, you can do a row. If you have weights, you can do the same thing with weights, 5-pound dumbbells, and just come straight back and just do a rowing exercise, just like that. And there's a bunch of strengthening exercises you can do as the next step to your own rehab. So if you try to do rehab on your own and you're not getting anywhere, so now you can look into something like what chiropractic does. Chiropractic in turn will work on not only your shoulder, but we typically would work on your neck as well as your elbow as well. Because remember, that joint is right here. You'll usually compensate. So shoulder injuries long term, you usually get some neck issues that come with this, and the elbow in turn becomes an issue as well. So typically most chiropractic docs that are dealing with rotator cuff injuries, they're not supposed to be working on your shoulder, they'll be working on your neck and your elbow as well, and kind of do all three of those at once. Lastly, you can follow an anti-inflammatory diet. Just like inflammation's in your body, if you eat a bunch of foods that are highly inflammatory, so you think of alcohol, baked goods, caffeine, fried foods, the standard American diet, the baseball park food or the stuff we know is not good for us, that's all inflammatory based foods. Right now you have a rotator cuff injury, you have an inflammatory based condition. So that's like adding fuel to the fire. So what I would recommend is following an anti-inflammatory based diet. So what you can eat, certain foods, think the color green. Green is a high alkaline based food. This is going to help with it's going to help with your inflammatory processes within the blood. So what do I mean by that? Broccoli, bok choy, spinach, romaine lettuce, green beans. Think dark green is going to be anti-inflammatory. Anything in the coconut family, coconut oil, coconut butter, coconut milk, all these things are going to be anti-inflammatory. Anything in the nut family, specifically walnuts, are one of the best anti-inflammatory foods to take in. You can also use things like seeds. Chia seeds are anti-inflammatory. Lastly, there's two more things. There's an essential oil you can put on called peppermint. You can rub that on the skin. That's an anti-inflammatory oil. You can also take turmeric or curcumin, which is a supplement you can take, and that's the strongest anti-inflammatory based supplement you can take in. You do all of those things and you're still having issues, well then chances are now would be the time to get that advanced study done. If it's lingering and you're doing this, it's still with you 6, 8, 10 weeks down the road, get the testing done. But hopefully you have this information to take home with you. So now what you can do, You now know how to fight this and work with it, and it doesn't have to linger, but at the end of the day, try to stay off those steroids and the meds as long as possible. Hope you found this information useful. Do me a favor if you like it during the replay, like this during the replay, share it to your friends and family who might be going through these injuries. And if they do, as always, they have a resource to reach out to. I look forward to seeing you all in the office. Have a blessed week. Bye now.